ನಿಮ್ಮ ಗುಡ್ ನೇಮ್ ಹೇಳಿ. ವಾಟ್ ಇಸ್ ಯುವರ್ ಗುಡ್ ನೇಮ್?
Prakash Markandi.
ನಿಮ್ಮ ಗುಡ್ ನೇಮ್ ಹೇಳಿ. ವಾಟ್ ಇಸ್ ಯುವರ್ ಗುಡ್ ನೇಮ್? So you just now
Prakash Markandi.
discussing on your so you just now discussing on medicines or oral cancer. You have told me that you are medicine for
Oral cancer.
Actually, I am telling you about her experience and since many people once actually why I am asking Renal Carcinoma. Suddenly many people once they knew that there is a carcinoma create suddenly 90% of their how they can come out. So that's why to create a happiness in their face. So how they can come out. I know how they can come out. So I just wanted to miracle things as well as how they can come out. So I just wanted to know so that people can.
And immediately you gave your prescription months back, and she did not go back immediately. She was here for 15 days because we wanted to try that she doesn't have any other side effects. She was very happy in those 15 days. Then she went back and she took another repeat dose about 10 days back. So totally about 1.5 months since she's been taking about 10 days. When she was in Ahmedabad, totally about 1.5 months since she's been taking nothing else to do. When she was in Ahmedabad, then I had brought them here because I knew about everything. After taking your medicine, her diet has improved. Then I had brought them here able to speak better because her speech was totally because the tongue is improved. And she was not able to speak better because now she is speaking better because swallowing is better because swallowing was not happening, so she was not able to eat also. Swallowing she is on liquid is better because swallowing was not happening, so she was not able to eat also. Overall also she is on liquid diet. She is eating better now. Internally is feeling better. Overall also she has you had told that you internally she is feeling good and better, and then we will you were told that you continue for another 1 more 4 months, and then we will review. So I told her you keep continuing for another 1 more. So in addition to that she is taking then when you come next to Bangalore we will come. Turmeric no, flaxseed. So in addition to that she is taking turmeric powder and soups. Turmeric no, flaxseed soup she is taking all the soups and all soups because earlier she was taking soups. Now what you have all the soups and all this and that because earlier she was taking now what you have in that book based on that those recipes and they are referring to YouTube. So those also there some YouTube recipes they have changed the tags she has put so those also there the tag they have changed the tags slightly. I think I have brought in this is the 8-9 patients in 2-3 months that I think 3 months since I know almost 8-9 patients in 8-9 patients 3 months that I have known 3 months since I came to know about you. I brought 8-9 patients and all are I came through Sai.
Oh right yes.
So I came through Sai.
Oh right yes.
Since then also 8-9 patients whoever I brought very happy.
But really see death is certainly
because immediately depression comes. But with this medication
he also feel happy
because immediately depression comes.
But with this medication from hope is
revival is
see that's why the moment you said that already I've seen some changes the moment you said that already
my uncle had
I've seen some changes from your auntie.
Then his itching has stopped totally.
Wonderful.
My uncle had itching. Then his itching has stopped totally. So he had dryness of skin and itching and all that. It is totally remember. He went to Bombay. He had the related dryness of skin and itching. He went to Bombay and told Nitin Deshmukh.
That's why you came for
Nitin Deshmukh.
I just 3 days back only. what he has taken for the same purpose. That is the retired inspector from Bangladesh. And it was he has taken for the same purpose. That is the renal carcinoma. And he gives medicines diagnosed in 2013. And he came to know about our medicines in February. And plus all others, paramin has come down from 2.4 to 1.8. Plus all other, the parameters have started. But they were actually not able to the doctor, the gentleman, about this chemotherapy. But thinking that if they say not, he was already treating him about this, so they should not. Thinking that if they say no, he was already there treating him since 2013. So they should not, feel.
Thank you.